Our 7 News medical expert, Dr. Cedric McFadden, is joining us today to talk about the questions you have about the coronavirus. They're being posted on our Facebook page. First off, we're going to talk about the record level of hospitalizations. 825 hospitalizations reported today. What is that doing to the healthcare system? How much stress is the healthcare system under?
So this takes us back to the conversation we had earlier on in March about flattening the curve and using the resources that it takes to operate or to run a hospital system. We first of all have to recognize their PPEs. There's personal protective equipment that we're having to use with not just COVID patients, but just through regular patient care. There's a whole litany. I mean, we're going into summertime where we have more traumas happening, and so we're using resources already for those patients. In addition, adding the COVID patient, it creates a situation where we may not have the equipment or the drugs or the medications we need just to take care of patients, such as heart attacks, patients that have cancer, even patients that have car accidents. Those are things we have to be prepared for.
All right, Deborah's asking about the beaches. Are they safe to go to? She has reservations and is worried. We've seen the cases in Horry County, for example, Charleston area, kind of on the increase.
So there's not a one-size answer for all beaches. It depends on the location of the beach, the number of people on the beach. Regardless if you're on the beach or not, it's important that we socially distance. It's important that you still have that 6 feet of distance between you and someone else, and considering sitting, away from the wind. If it's windy, you don't want to be right next to someone that could be blowing particles in your area.
Jacqueline is asking, I stay home and I'm disabled. My health isn't the best. I have asthma and wearing a mask causes me to cough. Using a bandana helps me do better with that kind of scenario. But what about people who are more severe asthmatic? How can they deal with the mask requirements?
There are different types of asthma. There's mild cases of asthma, moderate cases, and really severe cases. If you have, mild to moderate cases, you're probably okay wearing a mask. But the people that have severe asthma, you're going to perhaps have more difficulty, and you may find yourself having to refrain, staying home, having someone else buy the groceries for you, and if you are going out, being sure that you socially distance as much as possible.
And an age-old question we get repeatedly, which is about sanitizing things. Angelina saying, what's the best to use, Lysol wipes or peroxide or bleach, or is it all okay?
Yeah, the EPA has all of those included under disinfectants. If you're using a disinfectant, you want to let it remain on the surface for at least 10 minutes before you clean it off and disinfect any germs that may be left on that surface.
All right, Dr. Cedric McFadden will be back on Thursday to answer more of your questions. If you have any, head to the 7 News Facebook page and add them to the list.